All right, guys. So I've been talking a lot about a doctor that um, I've mentioned a ton of times in the coaching program and in this free group. And I wanted to take the time to kind of introduce him and get him on here so he can answer a lot of questions around metabolism, hormones, and kind of addressing deficiencies. So that's what we're going to talk about today. And but I want to start by introducing Dr. Castanho or Dr. Matt. I'm not actually sure which one I'm supposed to call you, but I go back and forth.
Either one's fine by me. Dr. Matt sounds fine. Castanho can be a mouthful.
Cool. So Matt, why don't you go ahead and kind of give a little background on yourself and just intro, and we'll go from there.
Sure. So I'm a naturopathic physician. I've got a practice in East Hartford and East Longmeadow. Graduated from med school back in 2017 and have been practicing since. I created my practice Wholesome Place back in November of 2018. And the main location is in East Hartford. Went to the University of Bridgeport and graduated from that 4-year degree. Prior to that, I was at the UConn Storrs campus, and I graduated with a degree in nutritional science and psychology. So essentially a modified pre-med track. Basically, for those who don't know, naturopathic medicine is a little bit different, well, quite a bit different than conventional medicine, whereby I'm not seeing things like, acute infections, strep throat, tenacious bacterial infections, acute ailments that would require immediate antibiotics, or broken bones that would require surgical interventions. I'm dealing with a lot of different chronic issues ranging from weight loss to hormonal imbalances, insomnia, anxiety, depression, a ton of GI issues. So the reason I highlight this is because what I do is my job is to figure out what the root cause is of chronic issues. So I'm not doing acute stuff. I'm doing chronic issues. And that's what we all have issues of today. That's what we're dying of. It's not, people aren't dying of dysentery and cholera like they were at the turn of the century. It's things like cardiovascular disease, heart disease, strokes, cancers, kidney issues, diabetes. It's things that develop slowly over time, and there's not just a simple pill that you can take for it. The problem is that we live in a society where we're so ingrained that there must be a quick fix, a pill that we can pop. But as I'm sure a lot of the clients that you have begun to know, that when it comes to making these changes to infect, a chronic change, you have to figure out what the root is and take some time. So anyway, that's what I do.
Very cool. I love it. And I think it goes along a line, like what we're doing go together, right? Like I think that the people in my coaching program would tell you that like it's a pretty holistic approach in terms of addressing weight loss specifically. Is but the problem that we're solving, right, is women are overweight, and the general ways that are popular in the United States or across the world to lose weight are like restrict your diet, do extra exercise, do all these things that I'm sure are part of they're part of the problem. And like, I'm sure you're seeing that from GI issues and things that you stress, things that you see in blood work. And like, so I think we're kind of doing a similar thing and like taking a holistic approach to solving problems. Yours is just like more medical, and mine is very specific to helping women lose weight by improving their metabolism and hormones, which is the overlap I think that we're seeing here, right? Is like the way that I'm doing it and the way that you're helping my clients do it. Because if you guys don't know, we work together in the coaching program. Matt runs blood work on all the clients that come in, and can get a full picture of like what's happening internally. Because if you don't do that, then you're just guessing, right?
Exactly. And to your point, it's a perfect marriage between the two. And the reason being is that when it comes to thermodynamics, which is a law, if you eat less calories than you expend, you lose weight. However, that simplified version doesn't take into consideration all the different hormonal and metabolic influences that control your metabolic output, how many calories you're actually burning. So we're so focused many times on cutting calories and doing a hypocaloric diet, but many times that shoots you in the foot because it negatively influences how many calories you actually end up expending per day. It can very much lower your metabolic output to lower than what it was prior to even restricting your diet, whereby you begin to gain weight and you feel tired all the time. So A lot goes into it. And I think, to your point, that's where this taking a peek under the hood with the biochemistry is vitally important.
Totally. So Matt is helping people in the program, like you said, biochemically by running the labs and addressing some of those things with the supplementation that he recommends based on the things you have going on in your blood work. And I'm kind of working with these individuals on, things that you're telling them, but like I'm like hands-on in their face a lot, like about their sleep, about their daily movement, about like de-stressing and all these things that we both preach. So I think it goes really well hand in hand. And so I want to take some time today to kind of, talk to you about what some of these deficiencies are, how they affect us, and what women can do to start overcoming those things so they can start making progress on their weight loss again.
Sure.
Cool.
So that's a loaded question. There's a lot that goes into it. So I'll start with the big components first. A lot of people know about the thyroid. So a little gland in your neck called the thyroid. And what it does is it controls the metabolism, essentially all of your tissues. So your brain sends a signal down to your thyroid that says, all right, we need to produce some metabolic hormone. The thyroid then produces a couple of different hormones that go throughout your body and essentially turn on your metabolism. You can consider it like the accelerator of your metabolism. If you don't make enough thyroid hormone, then the accelerator goes down and energy goes down, your capacity to lose weight goes down, you become constipated, everything becomes sluggish. If the accelerator is pressed too hard, which is very, very minute number of individuals, well, then all the other things happen. Weight loss is really fast, you're anxious all the time, you're having loose stools. So you got to kind of strike it in the middle. And there's a lot of different things that can control thyroid function, namely your vitamin and mineral status. In order to make your thyroid hormones, you need certain vitamins and minerals, namely iodine, selenium, enough vitamin D, enough iron, zinc. If you're deficient in any of these things, then the thyroid oftentimes doesn't work well. And even though a conventional practitioner may run a very rudimentary thyroid scan and say, hey, thyroid's looking good, it can be suboptimal. So number one, thyroid function. I would say another one is cortisol. And we can touch more on this later, but there's these little glands in your back on top of your kidneys called the adrenals. And they're responsible for doing a whole bunch of different things. But one of which is called the producing a hormone called cortisol that gets a bad reputation because it's associated with stress, but it actually gets secreted to help you adapt to stress. So just like, fire trucks attending a fire, if cortisol is the fire truck, it's not the fire trucks that are the problem. It's the fire that's necessitating the fire trucks to be there. So what I do with a lot of patients is I run their cortisol level right when they wake up in the morning. They wake up, they drink water, they go right to the lab, and I want to see what their capacity is to produce cortisol. Is it coming back way too high and they're in a constant state of stress? Is it coming back way too low and they're already burned out? Or are they somewhere right in the middle, indicating to me that they still have this very important function? So what does cortisol end up doing? Well, it decreases inflammation throughout the body. That's why people get cortisone injections in their joints. It increases carbohydrates and sugar in the bloodstream when you haven't eaten for a while. That's why it's supposed to spike in the morning. Right when you wake up, you haven't had anything for a while. It helps you neurologically focus and hone in. But cortisol elevated for too long because of stress due to taking care of the kids, paying the bills, not getting enough sleep, fighting infection, nutrient deficiencies. Too high a cortisol can cause a redistribution of fat and even muscle, can cause muscle breakdown to go from the peripheral extremities, the arms, and actually cause a redistribution to the stomach. So a lot of times when people are complaining about that tire around their waist, it's actually due to chronic stress. Mm-hmm. Or on the other end of the spectrum, the cortisol levels crash because they've been high for so long that eventually the body can't keep up anymore and it ends up plummeting. And in those types of circumstances, people feel like the wick that they have before the dynamite explodes and they lose their shit has just gotten shorter and shorter and shorter over time. They don't have the same level of patience that they did before. So running that hormone, super important. And I'm sure any women can agree that the level of stress is pretty much ongoing. Nobody gets a break anymore unless they're specifically setting aside time to meditate, be present, take time for themselves, get a massage, do some type of restorative exercise. We just live in a society where being chronically stressed all the time is the norm.
Yeah.
So thyroid function, cortisol function, those are just hormones.
Yeah.
And then there's a whole host of different nutrients that are important to check for. like the vitamin D, selenium, zinc, iron that I talked about before.
Cool. I think one thing I hear so often is, Andrew, like my thyroid is working. You mentioned this. My thyroid's working great, so my metabolism must be good. And I'm like, well, you're eating 1,200 calories and it's accurate, and you're not losing weight, so your metabolism is not working good, right? So what is going on there when someone's thyroid is seemingly working okay, but their metabolism is clearly not functioning well?
So, okay, think about how I can. Okay, so most conventional physicians run something called a TSH, stands for thyroid stimulating hormone. It's a signal that's sent from the brain down to the thyroid to basically, come on, produce some thyroid hormone. In response, the thyroid then produces two hormones, something called T4 and T3. T4 is inactive. It doesn't do very much. It has to get converted by the body into T3, and it's the T3 that goes around and turns on the metabolism of all the tissues. That's the real accelerator. The presence of both of these hormones then feeds back up to the brain to say, hey, the thyroid is doing a great job. You don't need to send such a loud, strong signal. And so the TSH value comes down. The conventional wisdom is that TSH should be 0.5 to 4.5. That's a huge range.
Yeah, it's very big. It's a big difference.
It's a huge range. What it really should be is 0.5 to 1.5. That's optimal. So if you're coming back at, 4.49, your conventional doc may say, hey, you're doing a great job. Thyroid looks great, and send you on your way. But you have all the symptoms of hypothyroidism. You're not losing weight. You're tired. You have hair loss. You're constipated. You're cold, especially in the extremities. You feel just sluggish. All hypothyroid symptoms. And a lot of my patients come to me having been told in the past that their thyroid looks great. I run their labs and they come back in the 4s, and I say, your thyroid does not look great.
Yeah.
So then you take it one more step, and it's like, okay, well, why doesn't the thyroid look good? Is it because there is a nutrient deficiency? You don't have enough iodine? That is actually what thyroid hormone is made from. Is your vitamin D not optimized? Iron is necessary for the actual docking of that thyroid hormone on the cell to stimulate it. If you're iron deficient, then that can be actually a cause of functional hypothyroidism. If you don't eat enough calories, your thyroid can look great, but there's a blocking hormone called reverse T3 that can get produced. And that reverse T3 essentially blocks the capacity for T3, that active thyroid hormone, to dock onto the cell. So literally, reverse T3 comes in and blocks it from actually working. Has that test ever been run? So there's a lot that goes into, is your thyroid actually functioning well? And that's just the thyroid itself. There's an intimate interplay between the adrenals with that cortisol. If your cortisol is too high and your thyroid looks good, you can still be functioning hypothyroid.
Totally. Cool. That was great. I think a lot of people don't fully understand that. And so they move on to trying to find other solutions for their problem when their solution is right there. Right. Like that's the problem.
Something also, so I think this is helpful for everybody. And I don't even know if I think I have spoken with you about this before. With every recommendation that I typically end up making with patients from at least a physiological standpoint, it's very helpful to put on an evolutionary lens. We evolved to be the way that we are today. Both from a dietary standpoint to, interventions with stress management and sleep and all that. So if you go on a diet that is too low of calories for too long, your body essentially thinks that it's starving. And the way for it to subsist and actually not die quickly is for you to down throttle your metabolism to be able to save the body fat that you have on your system that you can then tap into for stores. If there's no animals around, there's no berries to pick, the men haven't gone and taken they didn't catch a moose today. Okay, maybe tomorrow. So from a thrifty standpoint, it's very important for us to not maintain a metabolic output at the same rate when we don't have enough food in the environment. Otherwise, we probably wouldn't be here today. It's been many times evolutionarily where we've had to go long durations of starvation, and we didn't die because we had a downregulation in that metabolism. We have that same mechanism today. We just now do it to ourselves on purpose, trying to lose weight.
Yeah, totally. So then we have all that. Now, what do you typically recommend for interventions for that? Because I, there's supplements and things like that, but like I want you to talk about what the interventions are for supplements, and then what the interventions are for like just general day-to-day things that they can do.
For stoking the metabolism.
Yeah, yeah.
So when it comes to supplements, the only thing, and I'm not advocating this, but the only thing that's natural that increases your metabolic output is caffeine. But the problem with caffeine is that if you have too much of it, you burn your adrenals. And now all of a sudden you have this exhaustion phase and all the stuff I talked about before. So I'm not a huge fan of using caffeine anything beyond 200 milligrams a day, which is something on the order of about a cup and a half to 2 cups of coffee. Normal cups, not a Starbucks venti. So caffeine from a natural standpoint, from a supplemental standpoint. In order for me to make a recommendation based on certain supplements, I have to see what's going on under the hood.
Yep.
Is somebody's vitamin D deficient? Is their magnesium level low? Is their vitamin A level low? All these different things are needed for the proper functioning of the physiology. If you don't have enough of them, your thyroid and all the other metabolic hormones aren't going to be produced. But from a dietary standpoint, I am a fan of doing a little bit of a reverse diet. A lot of times people who have been trying to lose weight, cut calories, and they do it for an extended period of time. What I actually want to do is systematically increase the number of calories that they're consuming to provide the information to their body that, hey, there is food around. We're not in a starvation time, to a point where initially they will gain a little bit of weight, but their energy will increase. Their hair and nails are probably going to start growing faster. They're going to start finally pooping more often again. And then you find, and there's a bunch of different calculators that can do this, but you find a general idea of how many calories somebody should be consuming a day based on their height, their weight, their gender, the level of activity that they end up performing. And then you actually stoke it a little bit beyond that to almost put them in a caloric excess before you scale them back to a safe caloric deficit. Yeah. When you do that, metabolism ramps back up. You just have to get through an initial, 3 to 5 pound weight gain. That's not actually fat. It's actually a retention of a little bit of water that then comes right off pretty quick again thereafter.
Yeah. Yep. I do that with all the women in the coaching program.
Good.
Depending
high
on
protein.
where they're at. Like, some people need it right away. Some people need it after they do a cut. But what I have found too is, and I'd like to hear your opinion on this, but like, if they are stressing a ton and they sleep like crap and they don't move their body often, it doesn't matter what you do. Right. So like, how do those things play into metabolism as well?
100%. I want to talk about sleep first. So there was a study, I forget exactly when the study was done, but it was on college Division I athletes. So they took a cohort of individuals and they checked their blood sugars beforehand. Obviously they're college age Division I, pretty much at the peak of health and performance. And everybody was super healthy. Their A1C, the 3-month average of where their blood sugars were, their glucose handling, their inflammatory markers, everything looked great. They sleep deprived them for 7 days, not a month, not years, like many people are when after they have kids, which I'm experiencing a little bit now. But only 7 days. They allowed them to sleep 4 hours a night, and they would go in and they would wake them up after 4 hours of sleep, and they had to do this 7 days in a row. At the end of those 7 days, they took the same exact biomarkers. Every one of them was functionally a type 2 diabetic. Their glucose handling was shit. Their inflammatory markers were through the roof, and their glucose handling was crap, because of the fact that their system was under a chronic stress for a week. Now extrapolate that to all the people who are not sleeping 4 hours, but 5 hours or 6 hours. Basically anything sub 7 is suboptimal. And so you do that for an extended period of time, glucose handling goes down, the chances that you're going to put on more body fat goes way up. And the reason being, same exact thing that we talked about from a stress standpoint. Evolutionarily, if we were stressed out, losing body fat was detrimental. We would want to put on body fat as a way to subsist and thrive when we didn't have food in the environment.
Yeah. Awesome. Cool. Yeah.
So sleep is huge. And then of course, to the same extent, stress management, meditation, some restorative exercise. I meditate every morning myself, and it's a non-negotiable. That's very, very important, both from a mental clarity and just brain functioning standpoint, and also so I'm not a head case.
What kind of things do you do for meditation?
So I'm a big fan of conventional meditation, where you're sitting on a cushion, sitting on the side of the bed, laying down on the ground, um, alert and awake, but at rest.
Hmm.
And so I use the Calm app. I
Hmm.
think there's so many different programs within them. I have every one of my patients, I make the recommendation that they download the Calm app and start with the 7 days of calm. It's 7 consecutive days of 10 minutes of meditation that gives you a little piece each day of what you're actually doing when you're supposed to be meditating. Because
Hmm.
people think, oh, you sit down, you close your eyes, and you just like don't do anything. That's not it at all. You're doing something very specifically, and it's typically focusing on your breath um, or a body sensation or something that you're hearing. But
Yeah.
the capacity to maintain a singular focus and not multitask and not plan and not commiserate about the past is very difficult in this age of TikTok and Instagram Reels.
That is true.
Yeah,
Focus is definitely a problem. That's
yeah.
awesome. Cool. So, okay. So specifically for women, what kind of hormonal imbalances are you seeing, and how does that affect them?
Um, a lot to unpack. I think a lot of it comes down to age. So, assuming that the majority of the population is in the perimenopausal or postmenopausal stage, this is super interesting. So, prior to menopause, estrogen is produced by the ovaries. After menopause, estrogen is also produced in the adrenal glands. So, the adrenals, the same places that produce the cortisol, also produce estrogen. But if those adrenals have been burnt out because of chronic stress, not getting enough sleep, the whole host of things I mentioned before, then there's a third backup mechanism in the site that estrogen is produced, the fat cells.
Hmm.
So people think that fat does nothing. No, it's metabolically active. It produces estrogen, and your body will preferentially put on fat and hang on to fat postmenopause or perimenopause when the adrenals aren't functioning appropriately. That's the only place now that you can produce it. The ovaries are done. So that's super, super important. So that 5 to 15 pounds that a lot of women say that they gained the moment they went through menopause is oftentimes because the body recognizes the fact that the adrenals aren't doing the estrogen dance like they should. And so their body puts on fat, and they can't lose, especially in the midsection, those 5 to 15 pounds.
Cool.
Yeah. So I know that's part of your answer. I mean, there's so many different stages of life that can come into influence.
Yeah.
I mean, estrogen and progesterone obviously play a big role, but anytime there's a big hormonal flux in the body, there is the risk that there's some type of autoimmune or immune deficiency or abnormality. So the thyroid can be negatively influenced by an autoimmune condition called Hashimoto's. A lot of times we see that during or after pregnancy. Same thing goes for menopause, even sometimes menarche, when a woman gets her period for the first time. If she has the genetic predisposition or is eating a diet that is causing inflammation in the body, that can cause this autoimmune condition that's actually quite common to manifest. And that causes hypothyroidism and then all the downstream effects that we talked about.
Got it.
Yeah.
So I end up working with, like, most of the women that are in the coaching program are 35 to 55 years old. So like most of them are premenopausal, like, or further away.
Yeah.
And almost all of them feel like they've had, I mean, and this is like words that are coming from their mouth, a shift in their hormones, right?
Mm-hmm.
And I'm curious to hear from you, like, how often is that really happening when you look into the blood work, or how often is it like just life has changed and they have kids now, their job is more stressful, they're not moving their body as much, they're sleeping worse, and like how often is it, or is it usually both?
Both. It's
Yeah.
both, 100%. Obviously, 35 to 50, in that range, you have menopause, perimenopause, and child rearing.
Mm-hmm.
So all of that plays a role. Obviously, the lack of sleep, the mental emotional stress, working a job, getting pregnant, having kids, getting breastfeeding, getting your body back online after all of that, and then for many women doing it again and again and sometimes again. That makes a huge, hormonal impact and hormonal change. Keep in mind, this sounds maybe crass or cold, and I can say this because I just had a child, but a baby is a parasite. It grows within you. It feeds off of your nutrients, and anything that you're consuming, you're giving to it's a parasite. Then it's born and it's still a parasite. It's breastfeeding. So a lot of women don't place the priority that's needed in restoring those nutrient deficiencies after they give birth. A lot of times people are so concentrated on a prenatal. What about a postnatal? What about all the supplements and nutrients that you just lost, raising this infant?
Yeah.
So that's super important. And then before many times the nutrients have been restored, you're pregnant again, and then pregnant again, sometimes pregnant again. So that can be a big impact. And then we just went through it, but first 3 months are brutal many times when the kid's not sleeping and you're up many times throughout the night. Same thing holds true, like I said, with those Division I athletes. I mean, if you're clocking in somewhere between 4 and 6 hours a night on a consistent basis for 3 months, your blood sugar handling is not going to be prime.
Yeah.
So carbohydrates are going to affect you differently than when you're, not in that stage. I will say this though, and there is some hormonal impacts that happen when you're breastfeeding and getting up that legitimately make women stronger than men. And if there was ever a question of who the stronger gender is before I went through this process myself, for sure they win. Not even a question in my mind.
Oh, that's funny. All right, cool. So I have one last question for you. And I sent this over to you before we started because and this is just something I'm really curious about. One of the things that I hear most often is that like their family history causes them to have a slow metabolism. It's my genetics. How much truth is there to genetics playing a role in your metabolism?
That is certainly a loaded question.
Let me ask it again. I know that genetics play a role. How much do genetics play a role versus other things that are happening in your life?
Okay. There is a very, very, very small subset of individuals who are morbidly obese. And we're talking like 400, 500, 600 pounds, where things like bariatric surgeries and all that are necessary because there is such a derangement in their genetics that no matter what they eat, they just store. Again, extremely small populace. For the vast majority of other people who are struggling with weight and feel like they can look at a donut and gain weight, sure, their genetics may give them a loaded gun, but it's the environment that pulls the trigger. And it's their lifestyle and dietary choices and exercise habits and consistency that influence the capacity to lose weight. It just requires a little bit of trial and error to be able to determine what somebody's ideal nutrient and meal composition is supposed to be. Some people do great on a ketogenic, high-fat, low-carb diet, and they can do that forever. Usually those people are the ones that are typically leading a more sedentary life, aren't exercising very much, but they just don't need the carbohydrates to power physical activity because they're not doing any physical activity. Some people do very well with that. Other people do horrible, and they should be on a higher carbohydrate, lower fat diet. And that doesn't even get into the potential influences of cholesterol and cardiovascular disease and all that. But just from a pure metabolic standpoint, it requires a little bit of troubleshooting based on genetic predisposition to what somebody does better at than others. However, usually the vast majority of people, I would say just based on my clinical populace alone, 85% of people, if they are consistent to a diet, move their body, manage stress, and get enough sleep, there's no issues losing weight whatsoever. And again, when I'm talking about that very, very, very low, small genetic populace, I'm talking about fractions of a percent. But to be fair, those people do exist. However, every single person that I've met with you, it's not genetics, it's lifestyle. They might be given a crappy hand, but you can absolutely influence that from everything that I just mentioned.
Cool. I love it.
Yeah.
Great. I was verifying.
Yes, absolutely.
All right, Matt. Do you have any other things that you want to talk about that you have like thoughts on before we kind of wrap it up?
I think we touched upon a lot of it. Like I said, we talked about it a little bit at the end here, but consistency really is key. And something that I used to do a lot of in a lot of education and just haven't done much just due to time is the fact that when most people consume carbohydrate, let me back up for a second. There's fat, protein, and carbs. Fat is vital. You need it in order to produce hormones. Fat produces cholesterol. The cholesterol goes on to produce estrogen and progesterone, cortisol, testosterone. It repairs cell membranes. It allows our skin to be pliable and healthy. You need it. It's vital. You don't want low cholesterol. You want an appropriate amount of cholesterol. So you need fat in order to make that. You need fat in order to absorb fat-soluble vitamins, vitamin D, that helps with your immune system, calcium absorption, bones, neurotransmitters in the brain, whole host of different things. You need it for vitamin A that affects your hair, skin, nails, vision, the immune system. You need fat for a whole bunch of different things. So vital. You need protein for muscle growth. You need it for neurotransmitters. You need it for your immune system. You need it for your gut, your cells. Super important. So these two need to be in the mix. Carbohydrates serve one function: energy. There's no structure that is provided from carbohydrates. Your body can make carbohydrates from fat and protein, so they're really a completely non-essential. They should be varied based on your physical activity and exercise output. And sure, they taste good. So from a mental sanctity and happiness and hanging out with friends, carbs should be in the mix to some extent. The reason I mention this is because we're so focused on specific diets. A diet should be well balanced and sustainable. Some people will do keto for 4 weeks, 8 weeks, and then they fall off and they eat a cake. And it's like, you got to find something that's sustainable for the long term so that you can be consistent with it. But what ends up happening is, for the vast majority of people, you have a barrel. Imagine a barrel in your liver that stores glycogen, your storage form of carbohydrates. When you go on a low carb diet, or you're following a diet in general, that barrel begins to get depleted to some extent, because you're not having your standard American diet with the French fries and burgers and soda and chips and all that stuff anymore. When that barrel gets depleted, your body has to use some alternative fuel source for energy. And so it begins to learn or relearn to use fat. Anybody who's walking around with excess body fat shouldn't be hungry. You have plenty of energy. You have all the energy you need right on your frame. You shouldn't be hungry if you have the capacity to use that for fuel. But people have lost that capacity because of the fact that we subsist so long on carbohydrates that the body doesn't need the machinery to burn fat anymore. It knocks it down and gets it away. It's called the mitochondria. Everybody remembers from high school biology, the powerhouse of the cell. Your body will lose mitochondria when it subsists only on carbohydrates because of the diet. You get that mitochondria back by exercise and eating an appropriate, consistent diet that doesn't cause these huge influxes of carbs. So really, I guess what I'm saying is, through your program, in your hands-on approach, the check-ins, the handouts, the texts, the emails, all of that is so vitally important to keep people on track, because it literally physiologically changes their metabolism, allows mitochondrial biogenesis, the creation of new mitochondria, and the capacity to then burn fat. Mm-hmm. So, I just want to give you a virtual handshake and how well I've seen the patients that I've been working with mutually with you, because people have done a great job. They're losing weight, and I think a lot of it comes down to the fact that you've got them on the right diet, you got them employing the right lifestyle and dietary habits, and it's consistency. They're staying consistent. They're not falling off on the weekends, boozing and eating cakes.
Yeah, cool. I appreciate that. Thanks for the
you got it, man.
Thanks for the little testimonial that we did there.
Yeah, we got it.
Awesome. All right. Well, I appreciate you coming on today. I think the women tuning into this are going to get a lot of value from it, and just kind of understand what's going on with their metabolism and hormones a little bit better, because it can be really confusing, and I don't think anyone actually knows what it means until you simplify it.
Yeah. Right.
Oh, cool.
Well, thanks for having me.
Right.
I appreciate it.
Great. And until next time, guys, what's the next one we got coming? I think it's me doing a live training. So I'll talk to you guys next week, I believe, with another live training. Cool.
Take care, guys. Andrew, thanks for having me.
Of course. Let me end this.